I can do. Let's do like a beauty thing. Oh no. But that won't make a difference to the Instagram. No. Are we live already? Oh! Wait, I'm catching up. I'm
it's
going
fine.
live.
People are still joining.
There.
Okay. Let's put them right next to each other. We can do both.
Okay, so we're live on both pages.
So part 2.
Let's put this more straight. Welcome everyone. So we're live on both of our pages, so you can see us either or.
Did you enjoy our last live?
Did you guys enjoy the last live? Actually, I think they did because we got so much positive feedback. I got a lot of messages. I know you got a lot of messages.
And people said that we described them to a T, which is...
Yeah, because we see people like you every single day, so we have an idea of what's going on. You know, there's the similar kind
especially
of issues.
the trauma and the post-birth trauma and hormone changes after that. That's what I had a lot of questions about.
So welcome everybody, right? Welcome everyone to the live. Okay, so let's start with the first question that we received. So you guys can, just to let you know, you can ask questions on here. We will try and get to your question. We would love for you to ask questions. We love answering the questions live because those of you who are on here live, you know, are priority because you've made the time to be on here. So let's go with the first question. The first question was about fertility. And so let's look at the physical and emotional aspects, because I think we need to start getting familiar with this idea that every situation in life has a physical aspect, and not every situation, but every physical situation has an emotional aspect to it. And so both need to be addressed. So I'll let you take over with the physical aspect of infertility.
So we know that in some cases there is a cause for infertility. Sometimes the patient has polycystic ovarian syndrome, sometimes it's endometriosis, but at times it's also an unknown cause, something that we can't put our finger on, or a blood test or a scan can't give us a proper diagnosis, and then we keep trying with these type of patients. But that being said, there are different treatments that are offered for it as well. Some treatments are hormone therapies, or where you have to be injected with hormones, and then you find that patient becomes very emotional. So it's already telling you there's some sort of link between the psychology behind it, and also what effects do hormones have on mood, and the other way around, what effects the change in your mood has on your hormones itself. So mostly we see these patients that have been struggling for years to fall pregnant. They start to gain weight with the progression of the disease that they have. Their pain becomes more and more excruciating if untreated. And then emotionally, how it sets them back, knowing that their friends and family keep asking them, when are you falling pregnant? When are you going to have a child? Why haven't you fallen pregnant yet?
Adds to stress.
It just adds to the stress. And if it's an unknown cause, then from a physical point of view, we look at regulating the female system, nourishing the uterus and the ovaries, and then stimulating the ovaries to produce a good quality egg. And if you produce a poor quality egg, you can find that pregnancy is not sustainable. So we do it from a functional medicine, from a herbal point of view, where we can actually help the patient to nourish, regulate, and stimulate the female system to produce a good quality egg, and then go on to have a viable long-term pregnancy.
So the point is basically to see if there's anything out of balance,
and
then work on helping the body, not just artificially giving it to the body, but working on helping the body to be
supporting the systems.
I love that, supporting the system.
So we need to look. So most of the time we request a blood test for these patients, and we look at which hormones or which part of the body is not happy. Sometimes it's not even a female-related hormone. It could be thyroid dysfunction, and they're not having
everything is
cycle.
Interconnected. We need to move away from this idea that the body is separate parts. It's not. Everything is interconnected. So you might have an issue in one area, but it's actually leading from this to this to this to this, and you need to make that connection.
Definitely. So from a physical point of view, you need to remember that it doesn't have to be a single diagnosis. And although you are a single entity, you are also a whole being. You're not part. You're not just your arm is not separate.
And so your mental, your physical, your emotional, all of them are interlinked, definitely, right? From an emotional perspective, over the years, what I've seen is if there's an unknown cause as such, there's often underlying issues. They could be, a lot of times, I don't know, we don't want to talk about this, but sometimes there can be sexual trauma that hasn't been addressed. And so things are not, intimacy is not optimal because the person is bringing in that trauma that comes from that. And it's very difficult to be in the natural ease and flow that allows for that to happen. There can be other, and that's not to say every single situation is that. That's one of the situations. It can be other situations. It can be is sometimes, I found this is there's underlying issues in the marriage that are not being resolved, or there's fears from past relationships or from child. There can be so many underlying issues, inherited or things that you've been through. And that's the thing. We need to start moving away from this idea that our emotions and our physiology are different. They are so intertwined in ways that you cannot even imagine. So if you need to treat something, whether it's fertility, whether it's anything, you need to treat it from a truly holistic perspective, which is I think what we touched on last time as well. Also, another very important one for fertility, and one that is not often spoken about, is the whole masculine feminine balance. And that's something that I really want to delve into more in the future. But for now, the masculine feminine is, a lot of us females, sometimes we have been grown up in such a way that the masculinity comes out too much. So there's too much of there's not enough of the feminine flow that comes through, and that can affect fertility and hormonal balance a lot as well.
And I think also in this day and age, when more women are working and take on more male responsibility than maybe generations ago. And for a man, that can also his physiology in terms of the way his reproductive organs work. Whereas for a female, they then just become more masculine in the way they become the dictators in the home. But that being said, a lot of what we're saying then could sound like maybe it's just all psychological, or is it all just pseudoscience? But there actually is a science behind it.
Psychoimmunology.
There's
an actual science.
There's a biochemical reaction that happens to you when you go through trauma. An emotional response, an emotional effect on the body can produce a physical response. And what happens is, in these patients, it affects their cortisol. So they stressed, and then all of a sudden their phone alarm is going off the next morning, and that is another stress, and that is what we call a micro stress. And then maybe they need to rush off to work, or there's some angry person on the road, and these are all micro stresses. But brewing underneath that, there's some emotional aspect that has really taken its toll, or maybe it was something that triggered you off years ago, and now you have these tiny emotional or micro stresses around you, and you start to produce cortisol. So cortisol should be produced when you are, it's like adrenaline. You produce it when in your flight state. You need to run away from a dog, or somebody's chasing you, and then your body goes into this response where it produces cortisol and adrenaline, and it shuts down unimportant organs in the body, and it revs up things like your heartbeat. And if your cortisol is constantly high because you're constantly stressed, then it's going to affect estrogen, progesterone, and insulin. And then in turn, it's also going to directly affect your thyroid gland. And that's why we find that people who are constantly stressed or have multiple years of small triggers eventually develop, although mentally they feel fine, they actually have a lot of underlying things going on. They develop things like hypothyroidism.
So let's talk about stress a little bit, because stress is something that none of us can run away from. It's a normal part of life. If it's all good and well to go and sit on a mountain somewhere and meditate all day, but the fact of the matter is we all have to live in a world where we have family, where we have work, where we have responsibilities. So stress is a normal part of our lives, and you actually have healthy stress and you have unhealthy stress. So there's almost like a curve, right? If there's no stress at all, then you go into lethargy, you're not motivated, life is just unexciting. So you need to have a certain level of stress to keep you going, to keep you motivated, just like you need a certain level of cortisol in the morning to get you going. You want to have that drive, you want to be passionate about something and feel motivated. But when that stress becomes overwhelming, that is when you start to go backwards. That is when there's a direct link between high levels of stress and a suppressed immune system, a compromised gut microbiome, and so on and so forth. And these lead to hormonal issues. It can lead to symptoms, which then can lead to infertility, all sorts of things. So everything is interconnected, and you have to work backwards, right, to get back to it. But when that stress becomes overwhelming, that is when you start to go backwards. That is when you start to go backwards. So when that stress becomes high, high levels of stress and a suppressed immune system, a compromised gut microbiome, and so on and so forth, and these lead to symptoms, which then can lead to infertility, all sorts of things. So everything is interconnected, and you have to work backwards, right, to get back to it. an important part about the stress is it's unavoidable, but what is avoidable, or what is under your influence rather, is how you deal with your stress. And for a lot of us, we have very poor stress management skills. We kind of, and I think in today's society, I see women all the time, we think if we plot and plan everything down to the T and everything is just as it's supposed to be, then everything is fine. So A, B, C, D needs to happen at exactly this time and exactly this way, and the minute one of those little dominoes falls down, that's it.
Then
we are falling apart. And so a big part of dealing with stress is, number one, letting go of this idea that everything has to be perfect all the time. You know, in Islam we have a beautiful concept, it's the month of Ramadan, and we have this beautiful concept of ihsan. And ihsan is striving for excellence. So in everything that you do, you put your whole heart in, you do it to the best of your ability, you do it as beautifully as you can. And then you leave the outcome up to the Almighty, and you realize that you have no control over the outcome. All you have influence over is how well you did, and that too within your capacity. Because I think, Dr. Baker, we also need to realize from day to day we all are different. Especially we as women, we have a 28-day cycle. We're different throughout that cycle. We're different. There are some times where you will feel very productive, you will feel very organized, and there's other times where your energy will start to waver, and you need to give yourself allowance for that. That it can't be perfect all the time, and it doesn't have to be perfect, right? So you can kind of go with that. The other thing is, if you can be more adaptable to situations not going your way, so you have everything planned, A, B, C, D, and then something happens and this part doesn't work out, that you have to be flexible and adaptable. I think in business you learn that as well. If you want to succeed in business, you just have to be adaptable, and then you try your best, and if things work out, alhamdulillah, and if it doesn't, then you have to try again another day. So try not to get too attached to the outcome of every single thing. Try your best, knowing that your best will change from day to day. Be adaptable when things go wrong, and don't get attached to the outcome. Those are huge in terms of helping you deal with stress better.
I think we have a question or a comment.
Okay, there's one for you. I have had a full thyroidectomy done, and I am on L-troxin as a replacement, but of course with everyday stresses or pressures affects the levels of the thyroid. What can I take as a supplement? That's a nice one, because a lot of people are struggling with thyroid issues.
Is. So because this patient doesn't have a thyroid gland, there's nothing. So if you still had some part of your thyroid gland.
Oh, I've had clients with that. Yeah.
Then we could actually help you to make that gland function by taking the correct supplements like fucus and withania, bacopa, zinc, selenium, and vitamin A, mostly those. And you don't have to take like 6 different things. They are available in complexes to your functional medicine practitioner or your complementary doctor. And then if you don't have a thyroid gland, then you want to focus on where is the...
You're getting cut out in your ones.
So we want to focus on what is causing it. What's behind you having the need for that thyroidectomy? Why did you have to remove your gland? And maybe it was because your thyroid gland was really out of control. But what was causing that? Maybe it was the cortisol. And then you want to treat the cortisol by using herbs that are going to help with adrenal gland function. But then you also need to look at why is the cortisol high, and maybe that is the stress, so you're not managing the stress. And like we said, you can't take away stress from somebody, but you can help them to manage it better, or by having better life systems in place, or trying to get over certain things in a certain way without just shoving it under the carpet. So for this patient who had a full thyroidectomy, it would be wise for you to see your practitioner or your functional medicine doctor to assist you with looking at what was behind the need for that thyroid removal, and then focusing on treating that root cause.
I just want to say something. 786 something said, Munira, I think we can treat you with some sabr. I think that's very insensitive, and you should actually apologize on the live, because everyone's degree is different, and you are not in her shoes, so have some compassion for that.
So always look at what was it was due to
thyroid cancer. So the sister had thyroid cancer, so you can keep judgment to yourself.
Okay? So look at that. Now what would cause somebody, or even a young person, to develop cancer? We're not saying everything is psychological. We're saying that sometimes emotional and psychological.
The symptoms feel very real. When you're having symptoms, they are very real, but how
do you measure tiredness in a person? A person with a thyroid dysfunction is feeling tired all the time. How can you measure tiredness in a person? You can't. So that is something that would border on whether it's mental, emotional, or physical. It's somewhere in between. But what are the effects from feeling tired? Me saying to my husband all the time is, I'm tired. He's gonna get annoyed with me. You don't want to hear that from someone repeatedly. But also put yourself in that person's shoes. If you had thyroid cancer and you were feeling this way, And yes, maybe you can't just treat it with any alternate medicine, but look at what caused the cancer. And we spoke about this last week, where we said maybe someone who's lost their child or lost a parent, they have issues with breast cancer or uterine cancer. It's trauma, and it's trauma to the female, the female heart, basically. And that can elicit a physical reaction from the body.
Yeah, definitely. Thank you for apologizing. That's fine. It's an oversight. Just to keep things compassionate here, that's very important, right? This is all for everyone's benefit, and it's not a place for judgment. So thank you for that. I appreciate it. So, and something that we don't think about also is if it's thyroid issues, although it's not a one-size-fits-all approach from an emotional aspect, I find in dealing with clients, although it's not so cut and dry, what you do have to take into consideration, if you have thyroid issues, thyroid is very connected emotionally, it's very connected to your voice and your ability to speak up. So if you're having thyroid issues, ask yourself, where in my life am I finding it difficult to communicate my truth? Where's there distortion maybe in somewhere in the way that I'm communicating? Do I need to find more effective communication strategies? I think us as women, sometimes we grow up in environments where we're not allowed to speak out. We're kind of told that we don't have a voice and we can't say anything. So thyroid issues can often be linked to suppressing the voice and not speaking out clearly enough. So if thyroid issues are something that you are something that you're dealing with, then ask yourself, where can I speak my truth more?
And then also you find that these patients generally, they become, anyone who has, if you're diagnosed with hypothyroidism, you'll know that a component of it is that you feel depressed. It's one of the symptoms is depression. And although depression is not a diagnosis, it's not the end. It's not something you would diagnose someone with. You always look behind that. But that is a major part of it. And then other symptoms like hair loss and fatigue and constipation. And constipation on its own is somebody holding something back.
So the large intestine is a lot about holding onto things. It's also about control. You find people who have gut issues, it's often about control, perfectionism, not letting stuff go as a protective mechanism.
Which is so linked to like the psychological aspect of what we're talking about in hypothyroidism. You can't talk about something. You can't let it out. You can't engage with someone else about what your issue is, and you just have to keep it inside you. But if you could, would it help your gland function? I think first, emotionally, just talking about it would make you feel better. That's the number one thing. Many patients or clients would have said to both Zaahida and I that I feel better after I just spoke about it.
It's just they have a space to air what they need to say without judgment, without anybody coming down on them. Somebody just giving a compassionate ear, right? So that's something that we all need to practice a little bit more as well.
So we're just letting the conversation flow to wherever it takes us. It just so happened that we started with fertility and we moved on to thyroid dysfunction.
So you're welcome to ask your questions if there's anything.
And sometimes that happens in a consult as well. A patient will come in. Okay, for me, maybe a patient came in for weight loss, but then we end up talking about something else that's bothering them and something that's affecting them physically. And at the end of it, it might be actually an emotional response by the body saying, I need help. Please help me.
So I think anything where you'll find that, I find this a lot, I'm sure you do as well, that when a client comes in or a patient comes in, they don't come in with one thing. It's usually a combination of emotional stuff and physical stuff. And then you'll find as you go along, it seems like it's very disconnected, but all of it is interconnected.
And I think also people generally want to know what can they do to lower their stress levels. And I feel every patient is different, but I like to ask my patient to do something that they can do to that makes them happy. It can be anything. It can be painting or some artwork or reading a book, but 5 minutes of your day just to do something that makes you happy, because we're too busy doing things for everyone else. We're dropping off for kids, picking up kids, dropping at madrasa, come home, prepare supper, then make tea, go to bed, read salah, go to bed, wake up the next morning, and you're back in the same routine, but you don't actually do anything.
Right. Somebody asked it. The first question is there a general way to control stress for everyone, or would it be personalized according to the person or patient? Excellent question. So yes, there are some generalized stress management techniques, which I'm going to be teaching really soon in an online course that's coming out, inshallah, by the end of this month. So keep posted, keep tuned in, and you'll find out when it's released. So there are general things that you can do. However, sometimes depending on the severity of it and depending on where your emotional resilience is at, you might need a more customized approach. If there's a particular situation in your life, let's just say your marriage is causing you a lot of stress, then you need to start engaging in what's going on in the marriage marriage, maybe I need to change my communication strategies, maybe I need to change my perspective. Stress management is a lot about shifting perspective and dealing with situations differently. She's shifting your perspective of what's expected of you as well. Sometimes I think we live in a society where we have extremely high expectations of ourselves, right? We feel like we need to be, do everything, be everywhere, and then we have social media adding that, and then you're seeing all these people living these glam lives and doing this and doing that. And you're looking at all of this and you're not realizing that they also have normal situations and normal lives and normal difficulties,
and
right?
you don't see all of that normal difficulties.
Nobody talks about that stuff, right? Except on my page, I talk about it. So the point is, there's all this going on. So yes, there's a certain amount of stuff that you can definitely learn. And then there are some customized techniques depending on your situation. Like I'm saying, it's about getting very honest with yourself. Is my stress largely coming from my marriage? Is it largely coming from my work? Is it largely coming from my from raising my kids? I do find sometimes we tend to overemphasize certain situations and deflect from those situations that are difficult to look at. So for example, someone might be having an issue with their marriage, but they don't want to think about that, so they overemphasize the issue they're having with their mother-in-law, and that takes center stage, but you don't actually want to deal with it. So it's a lot about having awareness and being clear with what is going on. And so one of the easiest things I can ask you, that you can tell you today, that you can start implementing today, is like Dr. Baker said, take time for self-reflection. So maybe after Tarawih today, sit with a cup of something warm to drink, something that you enjoy. Take out a piece of paper, take out a journal, and say, what are my biggest stresses? And write down what that is, and then ask yourself, okay, how can I shift my perspective in each one of these to make it a little bit easier for myself? So if I started with a 9 out of 10 of stress, or what would I need to shift within myself, my own thinking, to take it to a 7 out of 10? Remember, Einstein said that you cannot solve a problem with the same consciousness that created it, with the same mindset that created it. So in order to deal with your stress, to find solutions for it, you need to first change mindset. Mindset is the most important thing. So open up the mind to see it from different perspectives. That's going to be very valuable for you.
Definitely. So these are small tips that we're giving you where you can actually see big results. There was this this podcast that I was listening to where a patient had seen a doctor. The patient tried to commit suicide, and he was then suggested to go and see his doctor for an antidepressant, and he was only 16 years of age. This was in the UK. And so the doctor happened to be a functional medicine doctor who understood that there's a relationship between the functionality of a human being and not just the brain being separate from the body. So he decided that this child is 16 years old. There must be a reason. He understood the family dynamics. There was nothing hectic or strange or unusual going on. And then he got speaking to the person, and it seemed like social media was a bit too much. And he decided that the treatment method would be, let's take away an hour of social media every evening and every morning and see how the child does. And that child never needed to go onto any medication. He recovered. He recovered from the sort of anxiety and depression that he was suffering from, just by cutting back on an hour, not even taking it out completely. I mean, we use social media all the time. We're not using it in a negative way, and we're also not using it to spread negativity. I feel a lot of what we see that happens on social media can affect someone else by making them think that their life is not as perfect as someone else's. And by sharing what goes on, I mean, I know the way Zaahida does it is she won't. It doesn't become a drama. You're not watching a soapy, but she makes you understand that there's a real life situation behind every individual. Somebody asked, what can you do about anxiety and depression?
So somebody asked, anxiety, can general anesthesia cause anxiety and depression?
It can actually, so side effects of general anesthesia can include changes in mental status or mental ability or function.
Okay.
You can treat that. You can actually sort of antidote the side effect of it. But if you need a general anesthesia and you have to take it,
temporary.
It's temporary.
So how long would if it's from the anesthesia? So it should be only a few days. It shouldn't be going on for once a month.
If it is, then obviously something has really been altered in your system, and you need to treat that. But why did you need the general anesthesia? Let's look behind everything. Let's look at why. Maybe you had an operation. Maybe you had a colon, something to do with your colon. Let's look at the colon. Let's look at the gut microbiome. See if it's balanced. Balance it if we can. And then what are the associated symptoms? Sometimes I've had 2 patients recently tell me that they have a little bit of, one patient said to me she has hot flashes all the time, like the whole day she's having hot flashes. And yes, she is perimenopausal or premenopausal, but I didn't think all of those hot flashes were related to just menopause. There was a certain component that said that this is stress and this is anxiety and this is actually a panic attack. So we're treating her both for menopause and her panic attacks together. Whereas there would be somebody else who would say that I keep getting this feeling inside me and feels like my heart has skipped a beat. I'm not having palpitations, but I'm skipping a beat now and again, and it's like a flutter inside me. Or somebody else would say I have this constant need to burp or a constant need to cough. And that is actually related to the anxiety. And you wouldn't treat this person for the coughing or the bloating or the burping. You're going to treat what's causing that anxiety, both psychologically and physically, using the appropriate supplements. Sometimes food can help you because your gut and your brain are related. If you're having poor things in your diet, lots of inflammatory foods, lots of sugar, then your gut is going to send a signal to your brain and you're going to feel anxious. In the same light, when you are anxious, your brain sends a signal to your gut, hey, I need to go to the loo because I'm stressed about this exam I have to write. And we all have experienced that. So there is a link. There has to be a two-way connection. It's not just one way.
Yeah. What is iron deficiency linked to? That's a really good question, because iron deficiency, it's more common in females, isn't it? So why is it so common in these days to be iron deficient?
It's a good question.
And what is it linked to? So we spoke a lot about gut microbiome. So in last week's one, we spoke a lot about gut microbiome. If your gut is not healthy, if your gut lining is compromised, then you're not going to be absorbing your nutrients from your food effectively, and that will lead to all kinds of deficiency as well, right? Also, you have precursors to iron. In order for iron to be absorbed, you need vitamin C, you need adequate amounts of vitamin B. So there's all of that. But what are some of the other things?
You see, if you look at your gut itself, there's a wall between your gut and your immunity. And if digestion is compromised, or we're putting in the wrong things into our diet, then that intestinal lining is going to be compromised. And what's on this side realizes that what's on the other side is not the same, and we then start to attack what's foreign in our body. And sometimes we see this in autoimmune diseases, and we also notice that those patients then suffer with deficiencies like vitamin D and iron deficiencies. But iron deficiency, on a more simpler note, can come from not eating enough iron or not absorbing enough iron. If you really aren't eating enough iron, then you have to start eating more iron or supplement with iron. But what we find is that iron works better when it's put together with vitamin C and B12. So we put it with B12, folate, and vitamin C, and the patient is able to absorb it better. If for some reason this patient is already on Ferimed or Chelafa or what iron supplement you're taking, and your iron levels are still not coming up, then you look deeper into the gut to see why are they not absorbing it. And if stress is playing a big role in that, then you need to focus on the stress levels and not just the nutrient deficiency. When you have iron deficiency, you also feel like that your heart is fluttering, you feel weak, you feel tired, you have dizziness, hot flashes. Those are symptoms.
Your circulation is poor.
Your circulation is very poor.
So tell us about the effect of stress on the gut.
So like we said, that gut-brain axis is quite we were supposed to do a whole event on this last year, but it didn't happen. And alhamdulillah, it's happening for so many more people now while they're watching our lives. But I think also from then to now, a lot of new information and new research has come out that saying that there is a link between these two. And like we said, if you're stressed, it actually has a biochemical response in the body. But also in the same light, if you hug someone or touch someone in a loving way, it has the same biochemical reaction on the body. So in terms of a treatment wise, if you do more hugging and more touching, obviously appropriate touching, then you're going to help lower your stress levels.
And that leads to having a better relationship.
Yes, and also you won't feel so depressed anymore. If you're someone who's always stressed and always anxious, or you stress about small things, then you know those people tend to develop ulcers where the actual gut lining has now been eaten into, or they start producing a whole lot of hydrochloric acid, which is your stomach acids to digest food, and they start having heartburn. But if we can manage those, we can even put them on an alkaline substance to lower the pH or to lower the acidity, but we have to at the same time look at treating the mental and the physical. So the food groups that they put in must be healthy and happy for the gut. Feed it good food, then it will feel good. Mentally you will feel good. But if you feed it bad food, then physically and mentally you're going to feel more depressed, more anxious, and more stressed.
Somebody, Zaahida Vadi asked a really good question, because we're talking about all the things that could be wrong, and she asked, how do you know if your gut is healthy? So what kind of signs, how would you know if your gut is healthy?
So if you're somebody who eats at least 3 cups of green leafy vegetables a day, then you probably have a better gut. If you have good skin and you're full of energy, you feel healthy and happy, I would probably think you have a good gut. Also, if you look at, I spoke about this morning on the radio, where if you take the gut bacteria of a healthy, slim individual and you put it into somebody who's obese, they will actually lose weight.
Yeah.
So a healthy person looks healthy and feels healthy and has a healthy mind. But someone who doesn't have a good gut microbiome or doesn't have a healthy gut will suffer with pigmentation, with hair loss, with skin issues, acne. They'll suffer with bowel issues, bloating, constipation, gas. It doesn't even have to be something related to the bowel. They can also suffer with joint pain, autoimmune conditions. The list goes on. So I think if you're looking for a root cause of your problem, the first place you should look is in your gut.
Yeah, and there's even a hadith that says that all diseases start in the stomach.
Definitely.
So it's very interesting that's
so if you
already
treat
there.
the stomach or you help your gut, then you'll actually
Helping
feel better.
everything. It's a holistic type of thing. So someone asked, Dilshad asked, what advice can you give a mother and a sister to cope with the sons or / brothers abusing substances? That's a good one, because I think this comes down to many of us deal with situations where we have loved ones that are in a difficult situation, and we've tried everything we possibly can. We've reached out to them in every way, given them every resource, and nothing has helped. I think a lot of us can relate to this, whether it's substance abuse, whether the person is having marital problems, whether they're just in depression, whatever it might be. We all at some point in our lives will experience a loved one being in a situation where you love this person so much, you want them to be happy, you want them to be well, you want them to thrive, but they somehow cannot seem to get themselves out of the situation, and you've done as much as you can possibly do, and nothing seems to have worked. And that can cause you a lot of stress, because if someone close to you is in a difficult situation and you're feeling helpless about it, that can cause you sleepless nights. That can cause you to lose your appetite and feel anxious and feel depressed as well. I think the very, very important thing to do is to understand that Allah has there's a bigger plan to everything. And even though something, it's not to say that you leave people to suffer, but you do the best that you can within your realm of influence. And understand, again, it comes down to this: you do the best you can, knowing that your best will change from day to day, and let go of the outcome, because Allah is in control. So you don't understand the bigger picture of why this person has to go through this process. It's not an easy thing, but Allah knows best. And also, here's a very important part: no matter, and you can write this down, that's how important it is, no matter how much you think somebody needs help or needs to do something differently, they need to come to that conclusion themselves. You can offer them the advice, you can offer them the perspective. I had somebody messaging me the other day saying he wants to send his wife for anger management. I responded saying the wife has to message me, because for you to say that she needs it just sounds condescending, and why would she want my help then? Because she'll come feeling resentful and feeling like she's forced to be there. So the person needs to be in a space to accept help, to want the help, and we can love them, we can try our best to be there for them, but we also have to ask ourselves, how much can I do without depleting myself? Because if you have a loved one who's abusing drugs, don't put yourself in a situation where you go so out of your way that you are not able to be there for your own family. You're not able to be happy and be with your kids and be with your husband and enjoy your life. There has to be a balance. You have to find a way and say, okay, if I've done everything, and then it's up to this person to meet me halfway and try, then I'm going to make dua, I'm going to offer help in whichever way I can, but I'm going to create clear parameters and boundaries as to how much I can actually offer them.
Take that step
because
back.
It's not if somebody is in a hole, the worst thing you can do is jump into the hole with them. You want to stay on the outside of the hole and throw the rope. So you need to find a way, you find a balance. How can I stay outside of the hole, throw the rope, and make sure that I don't get pulled in?
Definitely. And this is commenting or question: how long after starting Perimed should you feel relief, and how long?
Nice question. So after you're taking an iron supplement, how long before you feel
better?
better?
You should be feeling better within the first week. then you know your iron supplement's working. I mean, with our iron complex, patients tell us that they felt a difference the next day. Depends on how low you are, but you should be feeling a difference within the week.
If you're not,
then wait a bit longer. Yeah, wait a bit longer. There's probably leaky gut going through where you're not actually breaking down, you're not digesting, so you can't
it's just coming out.
It's just coming out again. And then you need to recheck at least once in 6 months or once a year. Once you've got your level stable, once a year. I do my bloods every 6 months to make sure, and I've seen them fluctuate when I do take supplements and when I don't. And I think it's important because it's helping me to function better.
I have a question. Is there a difference in because I know there's the acceptable levels from an allopathic, so a Western medicine perspective. Is there a difference between what's an acceptable level of iron from an allopathic perspective versus functional medicine perspective?
We use the same labs, so the same ranges, but we focus on if a patient is borderline as well. We don't just if I had a patient.
You don't wait for depletion.
So I had a patient, for example, who had, to give you an example, who thought that they had hypothyroidism. So we sent the patient for the bloods, and the blood results came back at 9.2, and the acceptable levels for euthyroidism, which means that they don't have a problem, is between 9 and 19. But this patient was at 9.2. So when she had showed it to a GP said, no, you don't have, it's fine, you're imagining it. You don't have any problems, you're fine. But we could see that the patient had thinning of the eyebrows, the eyebrow hairs were literally falling off, they had a hair loss, they were fatigued, they had some pigmentation, their cycles were becoming irregular. And when I looked at the test results, I noticed that the TSH, which is the thyroid stimulating hormone coming from the brain to your gland, was a little bit more than, it was closer to the upper limit of normal. So it was like her brain was telling her gland, work more, and her gland was like, I'm tired. Yeah. It's 9.2. It drops 0.3 levels more, and then she would be underactive. So we didn't wait for that patient to retest in 6 months and gain another 6 kilos and feel even worse. Yeah. We felt that we can support this thyroid function, and that way the patient now her levels have gone up 2 units in just 3 months. So that's amazing. But look what was behind it. It wasn't just that she had a borderline underactive thyroid, she also had immense stress levels, and she's vitamin D deficient. So we treated the vitamin D, and she's going through her stress issues and dealing with that and learning techniques. So I think it's important to look at what's behind it. So look at why you're not absorbing the iron. It could be because you have leaky gut syndrome. It could be because the type of iron you're taking is not suitable for you. But everybody's different, and we'll find different reasons and causes.
I think the important thing here is a lot of us go into the health shop, and then we have all these symptoms. I'm feeling like this, I'm feeling like that. What supplement should I take for this? And you take this basket full of supplements, and then you're not even sure if it's helping. The important thing is to test. You must test and see what are my levels right now, so I can see what's because you might think, oh, it's an iron issue, but it actually turns out to be a vitamin D issue. So you need to just test and see where you're at, then take the supplements for that, and then retest.
We had a patient who was toxic on a vitamin. She didn't know she was taking too much of it. And there's another question there that says, I get really bad bowel when I start taking vitamin D tablets. Is this normal?
So are you talking about loose bowels? I think
sounds like okay. It's probably a too high dose, and your body is just rejecting it, which is common if it's a 50,000 IU.
So try a different supplement.
Try a liquid form. I find that patients absorb
it better. Play around with it. Don't just say, oh, vitamin D is not for me. Play around with it. We live in 2019. There's tons of stuff out there.
Vitamin D is the vitamin of the century. We have our own vitamin D that works really well. So maybe if you'd like to know more, you can just Farida can
definitely. Okay. So someone said, what can cause loose motion frequently? Again, gut health. Because if you're constipated, or if you're having runny tummy too much, then both are attributed to.
Actually, now that this particular patient who sent this message, we just communicated a bit, and I did notice that the working conditions are very stressful, and I think think that you have to think about the gut-brain axis, and if you're constantly under stress, then you're going to constantly have these issues with your bowel, either to be constipated or to have a diarrhea or a loose stool. And that is what irritable bowel is. It's an irritated bowel. Irritable bowel syndrome.
Why is the bowel irritated? That's what you've got to ask. Is it because there's a deficiency? Is it because you're eating inflammatory foods? Is it because you've got trauma? Is it because you've got too much stress? Is it? And then look at all the different, that's why it's a holistic thing.
And so,
our bowels should be happy. They should not be irritated.
They shouldn't be. And sometimes these might be triggers that we're putting into our system every day. So if we're eating the inflammatory foods, if there's too much of gluten or too much of something in your diet and it's constantly under pressure, then those are the triggers. See, if you take out the triggers, you've taken out a lot of the problem. But then go before that. What was mediating this whole thing? What came before that? What happened when you were born? Were you born by C-section? Was it a natural delivery? Were you sick? Did you need antibiotic therapy?
Well, that's a big one. If you've taken, I think we need to say this because some people don't realize this. If you've taken antibiotics, that is going to compromise your gut microbiome, because basically antibiotics is there to kill the virus, but it'll kill the bad bacteria, but it'll kill all the bacteria. It just comes in and annihilates everything.
Sterilizes your gut.
It just sterilizes, so you're left with nothing. So you need to rebuild that gut bacteria by eating lots of prebiotic and probiotic foods.
And feeding your gut bacteria.
Feeding the gut bacteria. So you're going to have lots of cruciferous vegetables. You're going to have lots. You can even take a probiotic. You can have collagen, bone broth. So you need to rebuild that again and give yourself, like, how long would you give yourself? Like a month?
3 weeks.
3 weeks to a month, right?
So the patients often get scared when you tell them you need to go on a gluten-free diet. I mean, even to me, somebody telling me go onto a gluten-free diet, it's not really appealing to me, because I would go to the shop and think, oh, what am I supposed to get? But nevertheless, that's why we don't just say go on a gluten-free or dairy-free diet. We draw up the plan for you. There's whenever my mom has milk, she gets constipated. What's the cause? Your mom can either have a food sensitivity to lactose or to milk, or she could even be allergic to it. We can test this through blood tests to prove we're not just making this up. There are tests to do to check for food sensitivities. And in South Africa, we have actually some quite advanced tests that will tell you down to whether you're allergic to garlic or ginger or a spice that you're cooking with.
Here's a question: can that change over time? Once your system becomes more balanced and more strengthened, can it change where you have a food allergy or intolerance, and say you've been treating your body well, getting everything in balance, and like 6 months to a year later it can be gone?
In the same light, people are not born with allergies. Some of them develop it over time. But yes, if you treat your gut bacteria and you treat the interstitial lining and whatever was the root cause, 3 weeks later you can reintroduce it to see how the patient does. If they're not ready for it, they'll tell you, I'm still having symptoms. But also in this case, like, people often say, okay, don't have cow's milk, have goat's milk. But the thing is, goat's milk is so similar to cow's milk that you're still going to produce an immune reaction to it, and your body's still going to have that constipation. So maybe we need to remove milk entirely for just a few weeks,
and then reintroduce small amounts, and then maybe you'll just be a person who can have little amounts every day, not a big bowl of cereal.
And as adults, we tend to lose lactase, the enzyme that digests milk, so we shouldn't be having too much of it in our diet. But people have this misconception that they have to drink milk because they need calcium, but you get so much more calcium from almonds, so maybe consider that, or look for an alternate source of calcium.
We're giving you ideas. There's so many resources, so much of education, like all, there's a lot of stuff there.
So Farida wanted to know about the liquid form of vitamin D. It's available on our website, drbakers.co.za, and you can click on shop and type in vitamin D and you'll find the vitamin D, and the dosage is 5 drops daily for 3 months and then once a week.
So Gallery Couture Durban said people need to know that antibiotics should not be your go-to med for the flu, as influenza is caused by a virus and not bacteria.
Thank you.
Very good point. Excellent point.
It's actually so we obviously have had this argument before, but when you speak to your GP about it in depth, they'll tell you, they give you the antibiotic to prevent secondary infection. So sometimes it's nice to argue the point that why would you get a secondary infection unless you're really immunocompromised? So if someone with HIV, or you live in a shack, or your living environments are not good.
Or you will have a particularly low immune system for certain reasons.
But then also as parents, we also have to think that when our kid has the flu or comes up with a cold or has a viral infection, they're going to have a fever, and the fever is there to denature the virus. You don't want to stop that fever.
You want the fever. You just want to monitor it.
Yes, monitor it. And there are some homeopathic remedies like belladonna belladonna works perfectly for a fever in a child. It'll help to break the fever without saying to the body, just cool down, you know.
The fever is a good response from the immune system. In a healthy system, fever should come.
And that's why when you give kids antibiotics from a young age, from the time they're born, you'll notice if you do it repeatedly that they are the ones who get food allergies and the food sensitivities.
That's the gut microbiome being compromised. Okay, so somebody said here, could leaving the pill, so I'm assuming the contraceptive pill make you pick up weight or change of appetite. So leaving the pill, I know when you go on the pill sometimes that makes you gain weight. Okay.
But for those patients with underlying hormone imbalances,
that they never treated,
but now what happens if this patient needs to pseudo treating? What if they needed to fall pregnant and they have to go off the pill? It does also mean that they had some underlying hormone imbalances prior to that, and we see a lot of those patients. So we obviously, if they're trying to fall pregnant, they have to eventually come off the pill. I had a patient the other day who was trying to fall pregnant, but her cycles are irregular. So her gynae suggested that she stays on the pill. But then how would she fall pregnant? So sometimes you have to look for alternative methods. If you can't do a treatment that's too invasive, or actually you shouldn't be doing such invasive treatments, look first for an alternative and
exhaust all your alternatives.
Leave that type of medicine for the acute emergency phases, because everything has a place in life. We're not saying leave out one type and only go natural. It's not about that. Even GPs can practice functional medicine. It's just not so common in South Africa. And
I think it's picking up.
Yeah, it's picking up, definitely.
I think it's the future. It's definitely the future. Yeah. Okay, so Humi's Kaka says, I've been lacking iron taking supplements. Taking supplements, but my hair still falls out like bundles of hair, and she's only 20.
Okay, so two things. Maybe it's not the iron deficiency that's causing your hair loss. It could be other vitamin deficiencies. It can also be peptide and amino acid deficiencies. Which one, we'll be able to tell you more when you have a consultation. Hair loss can also be related to a change in hormones. That's why women, after they have a baby, their hair is not falling because they're breastfeeding. Their hair is falling because their hormones are imbalanced. So you need to actually target that, and then your hair will stop falling.
Even if you're 20, you could still have high amounts of stress.
Yes.
You could have trauma that's untreated, so there could be an emotional component as well. Also, sometimes when you're younger, your stress management techniques are worse, because as you get older, hopefully you have developed more of those. So also look into that. Humi, I would invite you to ask yourself, where in my life am I getting very stressed out? Because that in itself could also be an issue, right? Someone says, how can... Oh, I love this question. Is it wise to take a tablet to stop menstruation whilst on Hajj? I love that question.
I hate that question.
Because I know some people take it even during Ramadan, so they don't skip fast. And should they be doing that? Because I'm saying if it's ordained by Allah, give in to the natural rhythms of your body. It's there for a reason.
You love it and I hate it for the same reasons.
Right.
Okay, you should.
So
you're meant to have a cycle.
Yeah.
If you
don't have a cycle, that's a problem.
Yes, that's a problem. You shouldn't be skipping cycles. Don't take anything to stop it. If you were meant to get your cycle on your Hajj, then that was meant for that to happen.
It's a hard one to swallow, though.
It is also, yes, it is.
But then what would you suggest? What about cycle syncing? What about checking on your cycle and see? You can change your cycle.
You know when you get accepted for Hajj, you know that you're going for Hajj.
Yeah.
So you look at how naturally you can regulate it. Yeah, because if you're going to take a tablet to stop your menstruation, when after your Hajj, what if it doesn't work? Then you're going to be bleeding throughout that whole month. You'll probably be spotting or bleeding, and it'll be more complications. But the problem is
someone says guilty but learned the hard way.
Yeah, exactly. And then when you finally do recover from that, you actually have so many more hormone imbalances. I have so many patients who've told me my cycle is irregular because I took this tablet to stop it when I went for Umrah.
Your body has a natural rhythm. Trust in that rhythm. If everything is working fine, leave it.
Just
right?
leave it the way.
Is there a way to shift your cycle a little bit? If you can already plot that it's going to be at that time, can you start shifting that?
There are food groups that you could eat. There's exercises you could do. If you build more muscle, you actually can slow down your menstrual cycle. Obviously there's
a science to it. There's a science, but basically there's a way.
There is a way. It's difficult, I would say, because you have to introduce exercise to that as well. but it's a safer way. It's safer in the long term as well.
Again, exhaust all your natural alternatives before jumping into.
So we answered that. The milk question we answered.
If a person doesn't accept that I'm sick, then how can he or she be treated? Great point. Yeah, definitely. So if that person doesn't feel like they need to change on something, then they're not going to change. People only change when they feel like they want to change something. So don't lose sleep over that.
So somebody asked, what's your Instagram handle? It's at Live Inspired.
At Live Inspired ZA, or you can type Zaahida Mahomedy, but Live LIVE Inspired INSPIRED ZA. Live Inspired ZA.
Okay, then we have a question saying, can you explain twitching in regards to anxiety?
Oh, I like that question.
So
nice
twitching,
question.
like
eye good questions,
cheek twitches. It happens when someone is it's definitely the nerve that's being affected there. But also if you look further than that, so one thing is we want to relax the nervous system. It's like overstimulated now. So when we relax it, we use herbs like valerian and passiflora. We also use minerals like magnesium and calcium if the patient is deficient. So look at the deficiencies as well. And then and then why isn't the patient absorbing the calcium and the magnesium through the gut? And also if they are absorbing it, is there the missing link of vitamin D, which allows you to use or absorb the calcium if you don't have that? So it's not just looking at it from one reason the patient is stressed, but they stress, the anxiety and the nervous tension is causing the imbalance in absorption of those essential nutrients.
So then you use the stress management techniques that we spoke about earlier in this live. So the live will be available for 24 hours. I'm going to try and upload it onto YouTube, inshallah, but it will be available for 24 hours at least. Zahira Vadi asks another nice question. I suffer from migraines daily. My doctor says it's sinus related, but I'm on every sinus medication on the market, but the migraines still persist daily. This is a really good one. There's a lot of people out there suffering with migraines.
Yeah. So in my books, if you have sinusitis, then it's inflammation that's happening in your sinuses, chronic inflammation. So again, we would remove inflammatory foods from your diet. The second thing is where is the migraines and where is it exactly located on your head? That will tell us whether it is sinus related. And taking sinusitis medication is not you need to remove the stimulus. So if it's carpet in your bedroom and you're allergic to dust and that's aggravating your sinuses, then you need to remove the triggers. But migraines daily can also be related to an iron deficiency or a magnesium deficiency. And we're actually doing a headache clinic now for some of our patients that can be treated for those deficiencies, and they won't suffer from migraines.
So another one is also, I've seen quite a few people for migraines, and from a emotional perspective, I find there's a lot of overthinking. So these are people, think about like you've got your Google Chrome open and you've got tabs and tabs and tabs and tabs, and you keep switching between the tabs. You're looking at this one and then you're reading there and then you're clicking there and then you forgot what. That's basically what's going on internally in the mind as well. So if you're someone, think about how your thought patterns are going. Are they running on a loop? Are you overthinking? Are you kind of burning your nerves in a sense?
Do you know what I do when that happens? When I feel like that, I go to my internet browser tabs, and if I I have an iPhone, so if you hold down on it, it says close this tab or close all 187 tabs, and I just close it.
Close all the tabs. So the best way to close all the tabs in your brain is meditation. Now we're supposed to be doing meditation in Salah. Meditation is basically just being in a space where you allow your mind to just be free of thoughts and focus. So coming up, inshallah, by the end of the month, I will be having a music-free meditation, because I know a lot of people just struggle to sit in silence. So and a lot of the apps out there have music and so on, which people don't like. So I've created music-free meditations that allow some visualization. It allows you to kind of get out. So in the first few minutes, you might struggle a bit, but then as you're going along, more tabs close, more tabs close, more tabs. I can't tell you what a difference. If you consistently apply that to your life, I can't tell you what a difference meditation can also make in conjunction with some of the things that Dr. Baker spoke about.
Let's answer this one more question. What would you test for in a patient if a patient is experiencing extreme anxiety for the first time, out of the blue, no family history of anxiety, no PTSD, and not easily affected by stress?
I would still look at the emotional aspect. There's underlying stuff. Just because you can't remember the trauma doesn't mean it's not there.
So Zaahida would look at the emotional aspect. I would look at a vitamin deficiency there. I would definitely put my finger on a vitamin D.
I would say go in that situation first sort it out from a deficiency perspective.
Do a blood test.
First do blood tests. try that out, do the supplementation. If it still persists, then I would say there could be repressed stuff. Remember, trauma can be inherited from 14 generations down.
Yes.
Trauma, it doesn't have to, because some people say, I didn't have any trauma. You can have trauma from 14, it can genetically carry 14 generations down. So it might not be your own, but there are ways to release it.
It alters your genes.
Yeah,
and that's
there are ways to
important
release
for
it,
pregnant
though.
women to take care of themselves.
Yeah.
There was also a question about insomnia somewhere.
Yes, I also had somebody messaging me about insomnia with regards to this live.
Okay, so you need to wind down firstly.
Meditate.
We were just talking about insomnia before this. You need to wind down before you go to bed.
Yeah.
So the blue light from your phone is a stimulant, it keeps you awake. But sometimes people really have clinical insomnia, and you need, and I had a patient like this the other day who came in by referral for insomnia, and he was like, if you fix my insomnia, I'm going to be here with a whole lot of presents and so on. And it was because I felt that his insomnia was being treated the wrong way. He was put on medication that improves that gets him to release dopamine in his brain, so it like just calms him down.
Okay.
Yeah, but the problem is the side effect is Parkinson's disease, and the patient wasn't really aware of that. So for me, it was more about getting him to, although he said he was not stressed, was to get his body to relax a bit more, get his mind to relax and not just shut him down, and then also take away any of the external stimuli. So from a physical point of view, like if you're somebody who drinks coffee, don't drink it after 12 o'clock if you suffer with insomnia. If you don't, well, then you can drink it later on, because everybody's metabolism of coffee is different, and the half-life of coffee shows up to be different in different people. And then do the winding down by removing any stimulus like your phone or alarm or something.
Basically, what are your 2 hours before bedtime? Like, that's the most important. We were just talking about this before this live, because I was saying in Ramadan I'm very wired after Taraweeh, and I'm doing a whole lot of work, and I know why, because I'm sitting in front of my computer, I'm doing work. Obviously, when I go to bed, I'm not ready to sleep yet. Normally out of Ramadan, I'm very, very strict with my wind down routine. So 2 hours before, no screen time, no phone, at least an hour before, no phone time, no screen time. Have a wind down, drink something warm. Babies don't just need wind down routines. We as busy adults, if your life is very busy, if your mind is very busy, if you're very active, you need a wind down routine.
And then also the next morning, step out into the natural morning light. Go and stand in your garden for 10 minutes, again away from your phone or from your laptop, maybe with something, a hot cup of something, whatever you prefer. If you're fasting, just go and sit there, because naturally you'll absorb vitamin D, or you'll make vitamin D from the sunlight. It also has when your feet touch the ground, it has a biochemical response in the body. And then so if your vitamin D is low, then you will have insomnia. It's one of the side effects of a deficiency. So if you can naturally get it from standing in the sunlight, if it's extremely deficient, you need supplements, or start with the supplement and then go on to the natural sources of vitamin D. So eating it through certain oily foods or fish and things like that will help. I think people often are afraid to take supplements, but you have to look at it as it's not a medicine, it's a supplement. It's just helping you, and it's
giving your body building blocks to create something, and hopefully your body after some time will be in balance to do it for itself. So that's basically, before we go off, because Instagram's going to cut us off in a few minutes. Farida says, have you come across patients who struggle fasting while suffering from post-traumatic stress? The ability to fast and ability to communicate or control emotions has become really difficult. Very good question. Remember, if you're suffering from some kind of trauma, your ability to deal with your emotions or communicate your emotions is going to be compromised. It's going to be difficult for you. So somebody who is dealing with trauma, what a person who doesn't have trauma would be able to easily deal with, they are now. So think about it. Everybody starts like here, and then something happens, and they're triggered, right? For a traumatized person, you're starting up here. So it doesn't take much for you to get triggered. So I would suggest that's something that you definitely need to work with. Do some seek out some emotional release help, some kind of therapy, body talk or whatever it is, because it's going to play a huge role. Like I say, we often, if you're getting very triggered by things and you know there's trauma in the system, releasing that trauma is going to go a huge, I see it with clients over and over again. Once you have released the trauma, the ability to deal with life's daily problems just goes to a whole new level. That emotional intelligence just comes through so beautifully.
I think since we're running out of time, I see there's lots of questions about which supplements to take. I'll put up some pictures on my page. It's at Dr. Ray Baker of supplements that we discussed today, and good ones that maybe you could possibly get for yourself. And then Zaahida is going to be launching her new online things
very soon, inshallah. Keep posted in the next week or two. Make dua, everything. We're just sorting out the technical aspects now, but that will be available very soon. So if you're not following, follow already. And you guys, if you're not following Dr. Baker, make sure that you follow.
So it's at Live Inspired.
ZA. Yeah, and it's at Dr. Ray Baker.
Yes.
RAE Baker.
Yeah.
Like the baker.
Simple, easy.
Okay.
So we hope you enjoyed this
Thank you so
live.
much for joining, and thank you so much for the amazing questions. With your questions, that's how the live is takes on a life of
and
its
send
own.
them through for maybe a next week's possible live.
Yeah.
And we'll put up a little question sticker and then you can
add questions. And then we'll see you next week, inshallah, for the third edition of the Ramadan series, inshallah.
Take care. Assalamu alaikum.